of the Arizona Department of Health Services. The Arizona Department of Health Services has invited thousands of Arizonans to participate in this town hall regarding COVID-19. The goal here tonight is to answer your questions and take them straight to our experts. This is why this event is being recorded and will be available for later viewing on the ADHS website at azhealth.gov/townhalls and on the ADHS YouTube channel. And you may visit azhealth.gov/find-vaccines to find a vaccination site near you. We are monitoring the phone lines, and we will officially kick things off here in just 2 minutes, going live on the phone across the state of Arizona, dialing out to 10 counties right now, as well as we'll be going live on YouTube, on Zoom, and on Facebook. We want to thank you all for joining us right now. My name is Carrie Pena, and this is another historic town hall that is being carried live on various social media platforms and over the telephone to more than 100,000 Arizona residents across the state of Arizona. We really appreciate you being here with us, and we're going to go ahead and kick things off. Let's begin our discussion right now on COVID-19. We have producers standing by who are going to get us launched here on all of our streaming channels. Good evening to all of you. My name is Carrie Pena. We want to welcome you to tonight's COVID-19 vaccination information telephonic town hall. Thank you so much for being here. And this is a part of the Arizona Department of Health Services outreach to thousands, hundreds of thousands of Arizona residents tonight. We will be focusing on your questions and specifically the next steps regarding having eligible children receive their COVID-19 vaccinations. There will be a lot of information shared with you tonight, and this is why this event is being recorded and will be available for viewing at a later time. You can also visit the ADHS website, azhealth.gov/townhalls, and the ADHS YouTube channel, and you can visit azhealth.gov/find-vaccines to find a vaccination site nearest to you. I'm very honored to be on this call tonight and on this live stream with 3 distinguished panelists, healthcare experts who will share with us important information about vaccinating children ages 5 to 12 against COVID-19. Again, we will be monitoring all of your questions, and we want to take as many questions from you as we can tonight. We will be going about an hour in length on this panel. I can see that there are thousands of people joining us on the phone. Thanks to all of you for jumping on tonight, and to all of you joining us on Zoom, on YouTube, and on Facebook. We appreciate having you here. Again, my name is Carrie Pena, and much more importantly, we want to tell you who's on the panel tonight. We have Dr. Richard Carmona, the 17th Surgeon General of the United States. He is also a top advisor on COVID-19 to Governor Doug Ducey and to the state of Arizona. Dr. Sean Elliott is a pediatric infectious diseases physician who serves as professor of pediatrics and medical director of infection and prevention for the University of Arizona. Our third panelist is Jessica Wrigler, who has been a real leader for the state of Arizona during these challenging times in coordinating resources, keeping the public informed on COVID-19 developments, as the Assistant Director for Public Health Preparedness at the Arizona Department of Health Services. And you can view all of our panelists' full bios and more information on the ADHS website. So we want to thank you, all of our panelists, for being with us tonight. And we are going to be discussing COVID-19 vaccinations as it relates to children ages 5 to 12 years of age, and we will be taking your questions live. So to the folks who are dialing in right now on the phone, if you have a question and you want us to take you live, just press 0 on your phone keypad to be added to the list. I'll be monitoring the queue, and we have a lot of people standing by to try to get those questions to me as quickly as possible. You can also ask your questions in the Zoom Q&A or in the comment section on the ADHS Facebook live stream of this event. You can also email questions to aztownhalls at azdhs.gov at any time during this live town hall. And we will try to get to as many questions as we can. If not, the folks behind the scenes tell me that they will go and answer every single question after the event finishes. And now I want to go ahead and kick things off with introduction to our panelists, Dr. Richard Carmona. Thank you so much, sir, for being here. If you would, just say a few words to introduce yourself to the audience.
Thank you, Carrie. Thanks so much for your passion and your commitment. You have been a real leader in helping us put this together and get the word out. And obviously to my colleagues, Dr. Elliott and our assistant director of public health, Jessica Wrigler. I'm Rich Carmona. I'm a faculty member at the University of Arizona. I'm a distinguished professor, been there for several decades, and was also the 17th Surgeon General of the United States. So my background, my education training is steeped in public health, especially public health emergency preparedness, which is what we're dealing with the last couple of years. Thank you, Carrie.
Thank you so much, Dr. Carmona. And now I want to go over to Assistant Director Jessica Wrigler. And Jessica, thank you so much for being here with us and for all of your work here in the state of Arizona.
Yeah, good evening. Thank you so much, Carrie, for hosting us tonight, Dr. Carmona, Dr. Elliott. It's just wonderful to see y'all and work on this important topic with you. I'm an assistant director with the Arizona Department of Health Services. I oversee our preparedness areas, which includes our infectious diseases and immunization programs as well, and I have been helping to support the state's COVID-19 response since we declared the emergency back in March of 2020. I'm excited to be here tonight. I'm also the mom of a 10-year-old who's fully vaccinated against COVID-19. Thank you.
Thank you so very much. And Dr. Elliott, if you would go ahead, sir, and introduce yourself as well.
Thank you so much, Carrie. And again, Dr. Carmona and Jessica, thank you so much for your service for this. So as noted, I am a practicing pediatric infectious disease provider. I'm caring for children, adolescents, young adults with COVID in the hospital setting, the emergency departments. I'm advising them in the outpatient setting. I also serve for the Arizona chapter of the American Academy of Pediatrics as the director of immunization and infectious diseases. So taking, I hope, a leadership role to take the message out to everyone who will listen about the benefit of vaccines against COVID and routine vaccines as well. So we've got a major fight on our hands, and I'm glad to be part of it. Thanks for asking me to join in.
Thank you so much. And we're getting a lot of questions here. Dr. Carmona, I want to go first to you. There's been debate in the community about the importance of whether or not to have children vaccinated. Will you take time to talk about this, inform the listeners and the viewers about your advice on this topic?
I will. Thanks for the opportunity, Carrie. First and foremost, I think I'll start out by just saying that arguably vaccines and vaccination is probably the most important advancement in the history of mankind because of the diseases that it can prevent. And I would remind all of those, especially people who have been confused. You know, there's been a lot of misinformation, there's been disinformation, a lot of stories that are confusing people. They're not sure who to believe because there's so many mixed messages coming at them. So tonight you have the experts to be able to get through that and just tell you the truth. The importance of this is pretty evident for all of you who are there, our parents, like some of our colleagues here. I'm a parent, I'm a grandparent, and I speak to you as a fellow parent and grandparent, not just as a physician or as a surgeon general, because these are very, very important issues. Most of us who have children are used to vaccinating our children. We know that we get vaccinated after that first year or so of after birth, when the immunity from the mother starts to wear off, and you get measles and mumps and rubella, and we get tetanus and whooping cough, a whole host of other things. So this is just another germ that has come into play that is causing a problem that in record time we've developed a vaccine for and allows us to prevent that disease from becoming very lethal, prevents hospitalization, prevents you from being on a ventilator. So for all the reasons I've mentioned, for a long history of vaccination in our country, for those of you old enough, remember polio. When I was a child, that moms didn't want you to go to school because this strange disease was causing children to stop breathing and get paralyzed. And they showed pictures of iron lungs. And Dr. Sabin and Salk came along in the 50s and 60s, and now we don't hear about polio anymore. That's not by accident. It's because there was a concerted effort by scientists, by practitioners, and all of our children get vaccinated against these diseases, so we rarely see them anymore. look at this virus, this coronavirus, as just another threat to our families, to our children, and get your children vaccinated and boosted appropriately, because we know that vaccines work. It is just so sound scientifically. And as I said, I truly believe we can make the argument that it is the most important scientific advancement in the history of mankind.
Thank you, Dr. Carmona. And for those who are dialing up and joining us on the phone, we do want to remind you, if you would like us to take your question live on the air, we have screeners standing by, folks behind the scenes, to try to get a sense of what you'd like to ask the experts. Just go ahead and press 0. And we would like to put you on the air. I'm also getting some messages here from Facebook and from YouTube. Thank you for all of those. And we'll be moving through those questions. Dr. Elliott, I want to ask you, people really just want to move on from COVID-19. News stories from around the world tell us that COVID-19 is still cause for concern. There is apparently another variant making its way across the world. Is this another reason why you're encouraging people to continue to get vaccinated, especially vulnerable populations?
Yeah, absolutely, Carrie, and thank you for that. I mean, it would be wonderful, I'm sure we would all agree, to come out from the pandemic, close the door, and say we're done. And certainly the signs are encouraging in the United States right now as we come through the Omicron surge. But indeed, as you noted, there are Omicron BA2, a subvariant in other parts of the world, which are prolonging the recovery from that. And this virus is a virus. It mutates just like all the other infections that Dr. Carmona mentioned. So we're not done with this pandemic at all. It is still very important to protect our most at-risk children to try and prevent them from getting sick. Also, and this is important, the virus and the pandemic is starting to move into familiar territory. It is starting to behave like the flu does every year, and the rhinovirus, the cause of the common cold, and respiratory syncytial virus. And the only way to prevent transmission occurring from the schools, from our school children that are truly the transmitters in those infections, and infecting us at home, infecting our grandparents, our immunocompromised family members, and taking it to the workforce. The only way to prevent that is to immunize this age group, 5 through 12, which is the highest risk for carrying this pandemic into permanency. So that to me seems like a striking call to do the right thing, get the kids immunized so we can protect all of us by acting through the kids.
Thank you so much, Dr. Elliott. And a reminder to folks just joining us on the phone, we are continuing to dial out to thousands of Arizonans. This call is going out to folks in 10 different counties here in the state of Arizona, more than 100,000 people. We are also streaming live on YouTube and Facebook. I'm getting a bunch of questions here. And a reminder, if you're on the phone and you want to ask a question, just go ahead and press 0. We would love to hear from you. To the panelists, people are wondering, and maybe Jessica, this is for you. Are your children, do you feel comfortable having your own children vaccinated?
Yeah, absolutely. I have a 10-year-old daughter at home, and she is fully vaccinated with 2 doses of COVID-19 vaccine. And she was vaccinated back in November when the approvals first came out for the 5 to 11 age range. Actually, we went and got boosted at the same time that she got her vaccine. I would highly recommend COVID-19 vaccination for our kids that are eligible. Many of her friends have been fully vaccinated right at that November timeframe when she was vaccinated as well.
Here's a question, and either Dr. Carmona or Dr. Elliott, this woman says, my kids are too young to be vaccinated and have been cooped up in the house for almost 2 years. Is it safe to start taking them out to public crowded places, or is the COVID-19 wave hitting Europe and Asia coming for us next?
That's a pretty wide-ranging question. I'll start and I'll kick it over to Sean. First and foremost, it's been terrible having us all sequestered. We've been at war for almost 2 years with an invisible threat that's taken the lives of almost 1 million Americans, and we've had about 80 million cases. So, this is a very significant disease. The thing that I want to mention here that is outside of vaccines is just the mental health toll as well. And we all speak about this at the Arizona Department of Health Services, that's Dr. Elliott as well. This is going to go on for a long time, even after the virus leaves us. And so for the children that have been sequestered like that, getting them back into mainstream as quickly as possible, but as safely as possible as well, making sure that they are not going to be exposed to people who are infected, making sure that if you have questions, you speak to your pediatrician to make sure you do it safely. You know, we've lifted the restrictions on a lot of the mitigation strategy, like masking and social distancing, but that doesn't mean it's gone. Like Dr. Elliott said, it's still in our midst. This virus is still mutating. The question posed was also about the mutations, the BA2 that's in Europe. And those are things that we need to be concerned with. But the best thing we can do now is get everybody that's eligible vaccinated to achieve that herd immunity as quickly as possible and give the virus less places to go and replicate and mutate. So us making the decision individually helps our family, our community, the nation, and actually the world to help extinguish this virus. Sean.
Yeah, thank you so much, Rich. I mean, I completely agree. And specific to the question as well, you know, for kids who are too young to be vaccinated, that's of course a clear concern. The BA2, that subvariant, is accounting for about 30% of new cases here in the United States as we currently speak. But that doesn't mean we have to live under a stone. Yes, indeed, restrictions are coming off. But I would urge all of us to continue to deploy the parent spidey sense. You know, yes, if it's outdoors, it's a lower risk if there's lots of airspace around. But do you really want your kid playing with the kid with the runny nose and an active cough who's coughing virus on your child? Probably not. So same things apply today as they do any year with the flu, with RSV. In an attempt to normalize this is another respiratory virus which can affect our kids at any time. Just use common sense, I think, is perhaps the message to deploy here.
Dr. Elliott, I'd like to stay with you. This is a comment, I believe, coming in either from Facebook or YouTube. When will 4-year-olds be able to get vaccinated?
Yeah, thank you for that. We are eagerly awaiting the evidence. And as always, and this has been a continuing trend, the vaccine products are there, but they are being tested for benefit, or what we call efficacy. That the safety of the vaccines, I think, has been clearly established in all age ranges, including in children under age 5. The challenge, though, is that
what pisses me off the most is that
whoops, I think somebody is
Matter sees.
All right, there we go.
Go ahead, Dr. Elliott.
Our brand.
Yeah. The challenge, of course, is proving that the vaccines are effective in that age from 2 through 4 years of age. And that data is being worked on, is being administered by Moderna to the FDA as we speak. Pfizer has gone to get additional data as well. So, you know, a recommendation will come when it's proven that the vaccine is both safe and effective. And the hope is sometime in April, so coming up soon, to have that data administered. So I can anticipate, and we all can hopefully anticipate, an answer and an approval coming up the next couple of weeks would be awesome.
Thank you so much, Dr. Elliott. And we're monitoring the phone lines. If you are with us on the phone and you want to ask a question live, you can go ahead and press 0. In the meantime, I'll continue with questions here we're getting from our various streams that are running right now. Jessica, I called several pharmacies today and they say they are not giving the 4th booster yet. When will I get the 4th shot?
Yeah, thanks for that question and for bringing that up. Just today, the FDA approved booster doses, or a 4th booster dose, or 4th dose. It's a 2nd booster dose for individuals who are 50 and over, and also some individuals with immunocompromising conditions. I would expect beginning tomorrow, if you're not able to get that today, you should be able to head into your local vaccine provider, either your pharmacy, healthcare provider, community health center, and get another dose of vaccine at this time if that's what's recommended for you. But we know that boosters for those who are eligible are incredibly protective, because some immunity can wane over time, particularly in older adults and those with immunocompromising conditions. And so getting your booster dose and then your 2nd booster dose, if you're eligible, is going to be really important to continue that protection against severe outcomes from COVID-19.
Thank you so much, Jessica. And we're getting flooded here with questions. For those who are on the phone with us, just a reminder, this is a COVID-19 town hall. We have 3 very distinguished experts here to take your calls. From Facebook, Dr. Carmona, they are wondering if your grandchildren are vaccinated and how old they are.
My children are all vaccinated. My grandchildren are, my granddaughter's 4 years old, so she's not ready yet, but certainly we will encourage her and the family to consider vaccination. I mean, I will point out that these are, as much as we here understand, there are still skeptics and people that are unsure because of the misinformation and disinformation. And so I have encouraged my entire family to do that. And my children, who are all adult, have been vaccinated. Their children are still very young, and so not at that age yet. But when the time comes, I would strongly suggest that they consider being vaccinated as well.
Jessica, a question for you from Facebook. When will the state of emergency end?
That's a great question. You know, we're very encouraged that we're seeing decreases in a lot of our critical metrics, right? And so our case counts have come way down. There's more capacity in our hospitals currently. Our hospitalizations associated with COVID-19 are coming down as well. I'll emphasize that public health continues, whether or not we're in a state of emergency, to do the things that we do every day, which is to monitor cases of disease, to ensure that we're helping to control and prevent outbreaks by providing technical assistance and education, to continue with these vaccination campaigns and making testing services available. And those things will happen whether or not there's an emergency declaration in place.
We want to ask a poll question. If you are with us on the phone, if you will have your child vaccinated, press 1. If you will not have your child vaccinated, press 2. Again, if you're on the phone with us and you want to participate in the poll question, will you have your child vaccinated, press 1. And will you not have your child vaccinated, press 2. Dr. Carmona, I want to go back to you as I'm monitoring to see the reactions here. Right now, it looks like 67% of people who are interacting with us say they are not going to have their child vaccinated, but these are early numbers as real-time numbers are coming in. As we take a look at that poll and continue to monitor that, Dr. Carmona, can you talk a little bit more about COVID fatigue? I know that you are on the front lines, really trying to continue to put out the latest information. You're in touch with the White House, obviously. You're a special assistant here to the governor. And what is it that you want to say to the public about staying, staying firm, holding the line?
Well, Kathy, if I might just, the numbers that you just spoke about before we get into that question, I think it's important with the numbers you mentioned so that people aren't discouraged. Like you said, they're very early, but there's what we call vaccine hesitancy. And Jessica and her team have been working very significantly to be able to educate the public, because the term vaccine hesitancy lumps everybody together who doesn't get a vaccine. But we've looked very carefully at who are the different people in those populations. We have immigrants who don't speak the language. We have people who don't understand what a vaccine is. We have people who are scared with misinformation. So we find that if we can identify those populations, we can bring the vaccination rate up, because the people just don't know, they're scared, they're getting misinformation. So I wanted to just put that in right there, because you had mentioned that the numbers seem pretty high, that 67% of people may not be vaccinating their children. And obviously that's a lot higher than the data that we have, but as you said, it's early information. But a lot of it is the misinformation, disinformation, and getting the right message to the people so that they understand, so that they can make what we call an informed decision. Can I take the second part of that question now, Carrie?
Yeah, of course, please do. And then I have a caller on standby that we're going to take live, but Dr. Carmona, go ahead and take the second part.
Yeah, would you just say it again so that the public?
Yes, just the fatigue that people are feeling. I mean, even I'm sure as we're dialing out, just to be frank with you, some people are like, look, we don't even want to hear any more about this. You know, I mean, that's just the truth. So what do you say to folks who are just feeling sick of it?
Well, I first and foremost, try and educate them as to the importance, as Dr. Elliott has said, and how Jessica says all the time. Just, maintain the mitigation strategies as best you can. We understand the COVID exhaustion. It's becoming quite worrisome. I've heard people say to me, you know what, I'm willing to take my chances, because I've just been doing this for 2 years. My kids haven't gone to school. There's a lot of stress in my house because of this. And I think it's just up to us to help people along where they are in that journey and help them to understand it's still important. It is true that most healthy kids do pretty well, but do you want to take a chance? There have been reported cases of kids going to the ICU, being on ventilator, and even some deaths from children being infected. So we sympathize, we understand this is a huge mental health burden, but we've got to pull together. We have to come together as Americans and not be separated by disinformation, misinformation, politics, stay focused on keeping ourselves healthy. I know that sounds easy, but I mean, I have to do it with my family and my friends, just like my colleagues do there as well. I'm tired. I want it to go away, but I still want to make sure that I do the best I can, not only to protect myself, but to protect others who are around me from getting the disease if I'm inadvertently carrying the virus.
And we have thousands of people on the phone with us. If you are on the phone or just jumping into this conversation right now, you were just listening to an answer there from Dr. Richard Carmona, who is the 17th Surgeon General of the United States. I want to go now to Heather Rowley. And Heather, you've been patiently waiting to ask your question. Go ahead, ma'am.
Hi, I'm a mother who lived through the economic crisis and the H1N1 pandemic in 2008 and 9 and lost my daughter to H1N1. She also had immune compromise. We had to live in the hospital and be sterile and have gloves and masks and things for over a year and a half. Most people didn't even hear about it then. High alert with hospitals and military because the elderly 40 and above had already built immunities to H1N1, and everybody under that age were affected. I have vaccinated all my other children, and Leilani, my daughter, was vaccinated her whole life with every other vaccine that has been studied for a while: polio, chickenpox, measles, mumps, and rubella. And I do agree, they have several, in a few of those that you have to have every few years. I'm a little nervous with my children who are under 12 right now to have them vaccinated with the COVID-19 vaccine that hasn't been studied for that long. I also, I was wondering, I don't want to have my children vaccinated right now until you have a further study longer on the COVID vaccines. And I think that every virus, organism, and bacteria on the planet is going to mutate and change to survive. And with every even nth of a degree of temperature change on this planet, every virus, bacteria, and everything is going to mutate to survive. So, what happened to the days when somebody would get chickenpox and the parents would take their kids to the neighbor's house so that they could get chickenpox and build their immunities to survive it and not just run instantly and get the vaccine?
Heather, thank you so much for your call. And I'm so sorry to hear about what you and your family have gone through. Dr. Elliott, why don't you go ahead and take a response to her if you would?
Yeah, thank you for that. And Heather, gosh, I'm so sorry. Boy, there's a lot packed into that question. I'll take the most recent first. What happened to the chickenpox parties? And I was encouraged to give chickenpox to my young brother when we were in our younger age. What happened is exactly that mutation and that progression of disease that you just mentioned, and that is that chickenpox never was a simple, safe disease to have. As we learn more, it turns out, it can infect and kill susceptible children, adolescents, and adults. And the same thing is true with COVID-19. We've been dealing this for just barely over 2 years, and an incredible amount of discovery has occurred. Yes, the pace is fast, and I absolutely respect and understand your concern and others that the discovery of the vaccines was too fast. We don't know everything. That's very true, but I do need to clarify that the science behind the vaccines for COVID, specifically the mRNA vaccines, is not brand new. I learned about it in the early 90s when I was starting my training. The science has been there for decades plus. This was the first major world attack that actually allowed governments, including our own, to support vaccine discovery finally with the money that was necessary to get good vaccines. It's always been there. So I need to point that out for people who have concerns about the newness of the vaccines. The type, sure, yeah, we just discovered, SARS coronavirus 2 just 2.5 years ago, but the vaccines themselves, the safety, the way they work, has been time tested, for decades already. To that end, then, as we discover more, indeed, this virus is just as potentially deadly to people at risk and even healthy people who are not at risk for severe disease. And so yay for discovery, yay for this country, yay for the scientists, yay for the support of our government to bring us to a time when we have products which work. And in that, trying to balance risk versus benefit, there's a ton of science, as Dr. Carmona and Jessica have said, to support use for the vaccines to prevent getting disease. There's a ton of experience for those people who are not vaccinated, who do not do well with COVID-19 at all. And I have helped care for those kids. I've seen them die in their hospital beds. I've seen that. It is not pretty. So you know, personal experience, of course, everyone has to make the personal choice. But I urge you, if you can, to talk to a trusted source, get the science, and see if that person can answer your questions more so than we can tonight in the 1 hour we've got. So thank you for that question. It's a critical one.
Hey, Sean, maybe it's worth adding, some of the most frequent concerns I get from parents are just what the lady said to us.
Mm-hmm.
That, you know, this is something new, you're experimenting on my children. And really, we have a couple of decades of experience with mRNA type of vaccine. So if it provides some reassurance to that mom who's suffering because she lost a child already and she's afraid of a problem with her other children, is that you just heard about it today or 2 years ago. But scientists have been working for decades on this type of vaccine. So it really isn't new. It was new coming to the public's attention, but it's been tested and retested for many years now. Is that a fair statement, Sean?
Absolutely. And thank you for clarifying that. That is absolutely true.
Thank you again, Heather. And if anyone else is wanting to get on the air with us with our 3 experts, go ahead and press 0. I want to remind folks we're also taking some poll questions, and just an update on the poll that we had up in a few minutes ago. Folks were asked, will you have your child vaccinated? Press 1. Will you not have your child vaccinated? Or a lot of people are kind of, on the fence, which is precisely why we're doing this town hall, to give out more information. So as it stands right now, 33% are saying they will have their child vaccinated, and right now 67% that they will not have their child vaccinated. So just for context, though, the numbers are still coming in, and we appreciate everyone who is participating with us. Dr. Carmona, here's a question that was written into us. And I know a lot of people are skeptical, and I'm sure this is not the first time you've heard about this, but this person is asking, how do I know that these pharmaceutical corporations developing vaccines aren't just recommending boosters and vaccinations for young kids just so they can make more money?
Again, it's another legitimate question. I think it is appropriately asked by parents who are doing their due diligence. It is the right question to ask. And I would ask the same questions. I have a lot more information, as does Jessica and Dr. Elliott. So the real issue is that we follow the science. Dr. Elliott is a specialist in pediatric infectious diseases. He reads a journal every month. He writes papers. He goes to meetings where they discuss these things. So the science is evolving over many, many years. And it's not just that. I heard that from several people saying, are you sure you're not just supporting the pharmaceutical industry? I can tell you absolutely that is not true. This is really about us being advocates for what is proven good science to help protect our children. That's absolutely the case. So I think we are plagued with misinformation, disinformation, and a lot of people who are making statements that shouldn't be making statements that confuses the situation. So again, I want to reemphasize, there is no evidence that there's any manipulation by pharmaceutical companies. In fact, we have decades of data that support what we're recommending today that's been published and peer-reviewed. Peer-reviewed means if Dr. Elliott and I do a study and say, based on our data, we think you should get a vaccine, before FDA will look at it, before we can move it to the public, peers in other universities and research labs have to review it and acknowledge that it is honest science way before it goes to market. So Jessica or Sean, please comment further, but I just want to reassure our listeners that there's a lot of due diligence done before anything gets to market.
If I may, I'll just tag on to that. That was just exactly what I was going to say. And thank you, Dr. Carmona. I think it's also important to realize that the process of drug discovery and vaccines is not cheap. And just full disclosure, I have no affiliations with pharmaceutical companies. I myself have found my own frustrations with the cost of administering and purchasing medications. But when you stop to think about it, to discover a vaccine or a drug takes a lot of time, and it takes a lot of money to do it safely, to make sure that we're not violating ethical standards, and more importantly, we're proving that it's safe for human beings to take. That doesn't just happen cheaply. So this country and the world have been so far lagging in drug discovery for all the other infectious diseases out there because there just isn't enough money to pay even the tiniest bit of a scientist's salary to make it happen. That's not money grubbing at all. That's just pure economics. Who's going to create a new product if they're not going to get paid for it? So it's reasonable to expect pharmaceutical companies to get paid for their product. Where I think that the mistake is that people think they're making tons and tons of money because we're talking billions of dollars in the trade. That is not a heck of a lot of money when you talk about the cost of drug to deliver and to create doses for the entire, not country, the entire world. So I think it's a matter of context and following the numbers effectively.
Thank you so much, Dr. Elliott. And we have a few people on hold. I want to get to some more callers. Davida, you've been patiently holding. Go ahead.
Thank you. My question is, and I was listening about how the mRNA vaccine has been out there forever and all the research and all of that for decades. And yet it took what? A special thing from the FDA to approve it and all this. I understand that it was okay for animals in certain situations, but a lot of the research animals died, so they had to stop that study. And now all of a sudden it's okay for us human beings to be given that vaccine without any really length of time on human beings. 2 years is hardly any time at all to experiment on a human being. And I'm just wondering why all of this is going on, that they're saying, oh, it's been decades, but suddenly, boom, here we are.
Well,
Dr. Carmona, do you want to take that? Or Dr. Elliott, I'm sorry, go ahead, sir.
Yeah, go ahead,
thank you for that question. I'll start and then open up for the others, because I was one who shared that data. Absolutely understand your concern. The challenge here is that we're talking multiple different vaccine products, and just that the science understand, can we actually use messenger RNA, mRNA, to effectively create a vaccine? That's where the initial part of discovery occurred, and that was back in the late 80s and early 90s. So to that point, it's not like this is a new magical treatment that suddenly was created over the last 2 years or so. Animal studies in which animals died with the mRNA vaccine, I would have to question those studies. I'm not aware of any peer-reviewed authoritative studies whatsoever, as Dr. Carmona mentioned, that support that at all. So again, we have to be careful about the source of our information. In terms of the safety of the vaccine, yes, we're just 2 years into this. However, keep in mind that millions upon millions of humans have already been vaccinated, both in initial studies as well as in real time. And the number of deaths directly attributed to vaccines is close to zero compared to the number of deaths directly attributed to COVID-19, which is, in this country alone, well over 900,000. We're almost 1 million deaths here alone, and worldwide 6.3 million. So relative risk, my friends, is anything we do completely safe for human beings? No, you can get hit by lightning walking down the street, especially today where you had a gift of rain. So I think we need to put these things into context and take the gift of an incredibly effective, proven safe vaccine with a lot of real-time data, not making up these numbers from the other parts of the country. And I see Dr. Carmona shaking his head, so take it away, sir.
No, I just can, all I can do is pile on, as they say, Sean. That was perfectly said. I think as physicians, we use something called informed consent. And to your point, we prescribe medications all the time for cancer, for infections, urinary tract, bronchitis, but you always tell the patient, this drug is used for this, but there are some side effects. You may get diarrhea, for instance, from taking this antibiotic. It will go away. So we always are obligated to present the risk benefit to a patient. And as you said, in this case, the risk is infinitesimally small, almost not recorded. I know of no studies where animals died from any experiments as well. So maybe this is misinformation that is out there, but I know the rigorousness of the testing that goes in to ensure safety and efficacy on every single drug. And when you think about the thousands of drugs that make it to market over many decades and the small amount of significant challenges we have, you said none of them are perfect, like you said. But, we do a pretty good job of upfront preventing anything from getting to market that can do harm. And last thing I'll mention, I think what she was referring to is the EUA, the Emergency Use Authorization. That's because all of that science for a couple of decades was put together. The best information said it is efficacious. It will help to prevent you from getting bad disease, and it's safe because we have no evidence that it's going to cause undue harm. And as Dr. Elliott said, then you weigh the risk and benefit. I think the questions you're raising are important. I think it's the due diligence that every parent should raise when they go to their pediatrician and have this discussion. It's our job to hopefully educate you and maybe convince you that some of that is misinformation and explain as much as we can to get you a sense of reassurance that this is a good thing to do for your children.
Thank you, Dr. Carmona. And Jessica, I want to direct a question to you. I also want to say, Michael from Sierra Vista, thank you for calling in. And we do have your question, and I will ask that in just a moment. And for anyone who is on the line right now, the thousands of people across the state of Arizona, if you want to get a question in, the town hall will be going on about another 20 to 25 minutes. So be sure to press 0 on the phone line so we can get you in the queue. Jessica, we were talking about that poll question and asking folks, will you, as of right now, how do you feel about getting your child vaccinated? And I'm wondering, because you are the Assistant Director for Public Health Preparedness at the Arizona Department of Health Services, where do things stand right now pertaining to children who need to be vaccinated? And what do you want to say to people who are listening and watching?
We've had a significant number of children vaccinated here in Arizona, but we still have a long way to go to get the coverage that we're hoping for in getting children vaccinated here in the state. It's so critical that we're having these conversations, and we encourage individuals with questions to continue to engage with us, as well as your physician or a trusted healthcare provider, and also trusted sources of information, so you can get the facts about the vaccine if you're still on the fence about getting your child vaccinated. We know that these vaccines are very safe and they're very effective at preventing the severe outcomes from COVID-19 disease. And so we're just trying to reach as many people as possible, answer direct questions so that we can share information and really help people feel comfortable with taking that next step for their children.
Jessica, thank you very much. Michael called in from Sierra Vista, and Dr. Carmona, perhaps I direct this to you. He indicated that according to the CDC, under 1,100 children under the age of 5 have died from COVID out of 81 million. This is the information that's being relayed to me. So I'm not sure about all these stats. Dr. Carmona, you would obviously have that information. But the question from Michael is, as a result, why do you recommend that children under 5 should be vaccinated?
Okay. Well, let me just start on those numbers. Again, I don't have the most recent in front of me. That sounds very high. But even for the children who unfortunately die, and some of them have been vaccinated, it's not common. You have to take into the context, well, tell me about the child. Some of them have chronic diseases. Some of them are on special medications and they're immunocompromised. In general, young, healthy children do fine with the vaccine, and it prevents them from being hospitalized, getting on a ventilator, and dying. Really, that's because the other thing that parents will say to me, well, my child was vaccinated, but they still got COVID. Yes, they may. That's not a guarantee. But what we can tell you statistically is that it's unlikely it will result in a hospitalization, very unlikely that it will result in being on a ventilator, and almost never that they're going to die from that. So I'll pass it over to Sean now, because that's really his area of expertise.
Yeah, thank you very much, Rich. Once again, it's an important question. How many children does it take to die or to have a severe outcome or to be ventilator dependent for weeks or months to justify getting a vaccine? And that's a personal question, of course. If it's your child, if it's my child, who thankfully is a young adult living in Chicago, fully vaccinated and boosted, but I would do anything that I could to help her avoid the pain and suffering of a long-term chronic hospitalization. And God forbid that she would die from it. But if you look societally, what is the cost of the life of one child to die from a preventable illness? I would argue that it is incalculable. And so as a parent, certainly as a physician who treats children, I would do anything in my power to create any intervention I could to help them avoid what we call morbidity, the pain and devastation of disease and death. So that's a circuitous way to answer your question. I firmly believe that vaccines are the route forward. We also, I think, need to put this into historical context. Influenza, the flu, which we have every year, and every year during a normal season kills anywhere from 30 to 60,000 Americans every year. And that's with vaccine preventable disease. It'd be far higher like it was in 1918 to 1920 when you have an outbreak. So we have a product which works. We have interventions which work. It's a matter of developing trust, asking these important questions. That's why I'm so glad we are having this town hall tonight to try and answer those. But this won't be enough. I absolutely know that there's many more questions out there. Have those conversations with a trusted physician, a trusted clergy person, a trusted neighbor, and try and get some hard data to help make those decisions. So thank you for that one. That's a tough one.
Yep.
Dr. Elliott, let me ask you, and perhaps Jessica, you might want to answer this as well, but for concerned parents, there are obviously a lot of concerned parents out there, unsure if the vaccine is right for them. What are the questions they should be asking? If they came to see you, what should they ask you?
Yeah, fantastic. I mean, I would want to be asked, and I think every parent should ask, the questions we're asking tonight. Is it safe? And more importantly, what are the challenges associated with vaccination? I've heard, for example, that there's something called post-vaccine myocarditis. Tell me about that. Well, and indeed, that there is a tiny, tiny risk of having an inflammation of the heart. It's mild. It goes away after a couple of days after the COVID vaccine. But I would want to hear the comparative numbers. What's the risk from having actual disease? It's 10 to 1,000 times higher. So what are the real risks? What are they? What can we do about that? And also, what can I anticipate as the preventative steps to keep my child from getting sick? So ask the hard questions and expect an honest, transparent answer. Pediatricians and practitioners in this state have been receiving training. I release a podcast every 2 weeks. Others have done incredible work just to help physicians, healthcare providers answer those questions honestly with the full extent of science possible. It's just a matter of asking the questions, going to the doc, going to the nurse, asking the questions.
Jessica, do you want to weigh in on that?
No, I think that pretty much covers it. I mean, there's the common questions too, like what can I expect to be the side effects today, tomorrow, and the next day? Will my child have a sore arm? Will they get a fever like they got when they got their baby shots? Those kinds of questions too. And then, asking for any, we continue to talk about trusted sources of information. So what are the sources of information that those answers are coming from too? Is another question to think about. Are they coming from the Centers for Disease Control and Prevention? Are they coming from peer-reviewed literature that we know is utilized in order to make all kinds of clinical decisions?
There are quite a few questions from folks who are immunocompromised. And here's one. If I get more than one booster dose, is that harmful? How much time should I wait between booster doses? If I get another one too soon, am I increased risk of, and then again, this goes back to the myocarditis question.
Yeah. Well, I'll start out and we'll pass it to my colleagues. First and foremost, the term immunocompromised is very broad for us because you can be immunocompromised because, for instance, you're an asthmatic who has to take chronic steroids. You could be a cancer patient. You could be an HIV patient. So there's a whole host of things. So I think that Sean would agree. We don't want to be giving specific advice to a given patient who's listening now, because that should be done between you and your provider, whoever that provider is. But in general, when you're immunocompromised, the thing that we worry about, and it started very early in this pandemic, was what do we do with the immunocompromised? Will the vaccine work? There is information now to suggest that, yes, the vaccine works, and you can actually measure antibodies if you have to. There's studies that have been published, again, peer-reviewed. This is not just our opinion, but studies that have shown the immunocompromised should receive vaccines. It will not hurt them. It's not going to impair them or make them any sicker, but it gives them a boost of antibodies that helps to protect them because they're a more vulnerable population. So I'll pass that to Sean now to take it further.
Yeah, thank you for that. And completely agree. Not all patients with an immunodeficiency or immunosuppression are created equal, but there are some important concepts which apply to everyone. The first is, indeed, there are some vaccines that somebody who is severely immunocompromised should not receive except with the advice of their practitioner. The chickenpox vaccine is one such, and that's just the way it's created. It contains a live virus which is modified so it doesn't create disease, but there's still the potential of creating harm. In the case of the COVID vaccines, however, the messenger RNA vaccines, Moderna and Pfizer, are safe and effective for patients living with any degree of immunodeficiency. That is a hard, cold fact, and that has been tested worldwide in multiple different countries. Where I think the questions are coming, and very appropriately, is it reasonable? Is it a good idea to get that booster dose? And absolutely. I mean, the FDA signed off on that even further today. I mean, this morning. So yes is the unqualified answer. So a second booster for somebody who's already received 2 doses and a booster of a messenger RNA vaccine is recommended by the FDA, adopted by the CDC. The timing is important here as well. And I think that's part of the question. The recommendation currently is to wait 4 months at least after the last booster, in part to get a good boost, and in part just so you don't needlessly get another injection with a little shoulder tenderness for not an additional added benefit. So 4 months out from the booster is exactly the right time to get a second booster.
Dr. Elliott, thank you so much. And we appreciate everyone who is writing to us on all of these various platforms. Again, if you're on the phone and you want to jump in with a question, be sure to press 0. Jessica, I'd like to ask you this question. This one is coming in online. How can I report a suspected COVID-19 case or outbreak at my child's school?
Yes, thank you for that question. So the best way to report a suspected outbreak of COVID-19 at your child's school is to contact your county health department. Our county health departments are boots on the ground, public health partners that conduct those investigations and provide the technical assistance and support for schools to do any kind of necessary contact tracing or to set any recommendations for isolation and quarantine periods. So your county health department is the best place to reach out.
Thank you so much. We have another caller here, Jocelyn. Thank you for being patient and waiting on the line. Go ahead with your question.
So my friend got the vaccine and she's sterile now, so like she can't have kids. So why is that?
Can you repeat the question, please? I want to make sure I understood it clearly.
Dr. Carmona, what Jocelyn said is that her friend received the vaccine and she's saying that she's now sterile and can no longer have kids. And she ended by saying, why is that?
Okay, well, I'll start again and I'll pass it to my colleagues as well. This actually is something that has been studied now, and there is no relationship between the vaccine and fertility. Again, I think this is some of that misinformation that got out on various spurious websites and in social media, because we do get a lot of questions about it at the state level, nationally as well. And I'm sure that Sean gets it in his practice. But I would like to reassure the listeners that all of the science indicates, and this is published, peer reviewed, this is not just a doc saying it. This is scientists reviewing other scientists' work, looking at the validity and saying, yep, there's so many people that were vaccinated. These were young women of pregnancy age, and they're able to say that, no, there is no relationship to fertility. So let me pass it to Sean to comment as well.
Yeah, thank you. And again, you're right. This is a question which has come up. I think it's important to realize that our gynecology and even obstetrical colleagues out there, in fact, the American College of Obstetrical Gynecology, have come out very firmly in favor of the vaccines and very specifically saying that there is zero effect on fertility, zero effect on trying to conceive, zero effect on babies born to mothers who are vaccinated. And one could very easily be suspicious and argue like, well, that's just the institution trying to protect its own. And I can understand that, except I don't know how many gynecologists, my wife's gynecologist is friend of the family. These are people who are really invested in trying to get women to get pregnant and to carry them through to delivery. There is no hanky-panky that they want the best for the women. and to heck with the science sometimes. So consider the source. Once again, this is a very believable source of firm belief in the vaccine and a very strong endorsement against any fertility concerns. So once again, I think that is one of the concerns out there, which is coming from artificial news.
Hey, Sean, another thing that might be interesting, some of the more recent information about the mom's immunity moving across the placental membrane to the baby. So actually the mom's immunity helps the baby. If the mom got vaccinated, it gets transferred to the baby and the baby is better prepared when the baby's born.
Absolutely. Absolutely. And the absence of that is, again, I've cared for babies who got COVID from their moms across that placenta when moms were not vaccinated. So, there's a lot to be said for proceeding with vaccine.
Jessica, I'd like to go over to you now. Here's a question from online. I'm a minor and want to get vaccinated, but my parents are anti-vaxxers and won't let me. What can I do?
I'm not sure if Dr. Elliott has run into that in his practice at all. There's a couple of different options, but generally you do need your parents' consent to seek medical care for certain things. Different clinicians will handle situations in different ways depending on, how that's presented and what the other standard of practice or care has been in that office for other kinds of office visits. Dr. Elliott, I don't know if you have any additional insight into that question.
Yeah, and thank you, questioner, for that question. And I'm sorry for the challenges. Thank you for wanting the vaccine. Yeah, absolutely. This is, I think, a fairly common occurrence. To the point that actually several of us, including the AAP chapter in Arizona, are partnering with schools, school districts, and student leadership to create a teaching toolkit that is accessible to not just our students, but for the students to use for their families, because this issue does come up all the time. What's been really quite impressive is looking at experience when students are empowered to help their parents learn, to affect the change, and then to actually bring their parents into a healthcare visit, have their questions addressed by the healthcare provider, and then move forward into vaccination. So specifically to the questioner and what to do next, if it is possible to try and get the folks to come into the healthcare visit with you, to let the doctor or nurse practitioner or whomever answer their questions and see if we can get a consensus to move forward. So thank you for your struggles in this one.
And here's another question from online. How can I keep my child safe when schools have been relaxing COVID-19 and masking protocols and kids aren't being safe in the classroom? Dr. Carmona, do you want to take that one?
Sure, I'll be happy to start. First and foremost, you can still train your children to mask up appropriately, wash your hands frequently, and do all of the mitigation strategies, even though children around them may not be. Now, the important point here is, and Sean's the perfect person to address this as a pediatrician. We are in uncharted territory where we have to ask the question, what happens to those preschool and early school kids who have missed school for 2 years? What about their psychosocial development? So there's not a perfect answer here. We want to keep the child safe from infectious disease, but we want them to learn the social skills. We want them to be able to read a parent's face or a teacher's face and hand gestures and things like that. All those critical skills you learn the first couple of years. So when we have our discussions, it's trying to balance that out. We want the children back in school as quickly as possible, but also as safely as possible. Now that transmission is pretty low and we're in a relatively safe time, I think if parents are concerned, they can still request the child to wear a mask, but still washing hands. And as best you can, if a kid is sneezing, coughing, etc., stay away. Hopefully teachers would intervene. And again, I'll pass it over to Sean and to Jessica for their comments.
Yeah, thank you. I think you hit all the very important points. It's a personal choice, and that actually has been the crux of much of the debate in school boards, et cetera. It's like my choice, my child, whether or not to have them wear a mask. And so, yes, of course, one can advocate for one's own child to wear a mask. The concerns come absolutely that child may be made fun of by the non-mask wearing children, and that's an unfortunate reality of school. School districts that are relaxing their mask standards are aware of that as a challenge and are reportedly taking appropriate steps to address bullying related to personal mask choices. Obviously, the easiest answer for those children who are old enough is get them vaccinated. That's sort of a no-brainer. But the kids under age 5 who are in the pre-K and K classes, strangely, studies have shown they're even better at wearing their masks when told to than our adults, and even young adults. And so there is that still as an option. Other than that, of course, is personal advocacy to the school district, to the principal, and requesting, steps to mitigate potential risk.
Thank you so much, Dr. Elliott. And I'm getting a bunch of questions here. We just have a few minutes left. I'm going to try to get to as many of these as I can. One that I think is really important, Dr. Carmona, you've brought up several times, I know in this town hall and previously, that people need to pay attention where they're getting the information. So the question is, when we look for information about COVID-19 online, who or what are the reliable sources of information?
Thanks so much. And I know Jessica and I and the team at ADHS and Jessica has already said it today, identifying those resources. They're easy. First, if somebody's trying to sell you something, that's not somebody you should be getting reliable information from. However, going to the Arizona Department of Health Services website, start there. These are people that are working 24 hours a day to make sure you're safe and posting only scientific validated data and recommendations. Go to the American Academy of Pediatrics website. Speak to your pediatrician. Speak to your nurse practitioner. Speak to health professionals whose only goal is to keep you healthy. They're not trying to sell you anything. Go to your university, University of Arizona, ASU, NAU, our universities, Mayo Clinic, University of California. They all have tremendous repositories of safe information that is about giving you informed consent to make the best decisions for you and your family. So that's the best. And I think my colleagues might add more, but I think that's the start. And, don't rely on social media flashes that come by your screen declaring something and making crazy assumptions, because that's what scares people and they don't know, what to believe. Go to reputable places that will provide you that good information.
Jessica, did you want to? Sorry, Dr. Elliott, go ahead.
No, I was going to say, I could not, that's exactly what I was going to say. And Dr. Carmona listed all the proper sites. Specific to Arizona, the Arizona chapter of the AAP, which is azaap.org, does have a section for parents, for even children who want to find out talking points and safe, practical information. The key point, as Dr. Carmona said, is go to the sites that are truly trying to help you and your children be safe, not trying to sell you something.
And Jessica, did you want to add anything there?
The only thing that I will add is that if you find a site that's making a claim, look to see what sources they're citing behind that claim that provides the evidence to support the information. That's another way to ensure that you're identifying a reliable source of information.
Great point.
Thank you all. And we're going to try to get one more caller on the line here. And I'll ask a few final questions before we wrap things up. Helen in Prescott, go ahead, Helen.
Yes, I just wondered why we couldn't use hydrochloroquine or going that kind of direction rather than going straight to the vaccine shots. Sure.
I'll start and I think we can all comment by, I would say that, first of all, hydrochloroquine is a medicine that's used to treat animals for what they call helminths, so worms. And generally, it is not effective against the COVID virus. So a lot of that information got out there early and people were looking at it as legitimate. It was not legitimate. There's no evidence to suggest that it should be tried or used. We also had people making claims about, using Clorox, using antiseptics, drinking certain things. I mean, there was a whole host of things that flooded the media the first few months. And again, if you're an average person, a mom and dad trying to protect your kids, and all this information is coming across your page, on on TV or on a radio, however you get your information, who do you believe? That's the problem. So the fact that I think it's great you've asked the question because it gives us the opportunity to address it for you. But 2 years into this, we're still having people ask that question. Why wasn't I given hydrochloroquine? Why wasn't I done it? People ask about injecting Clorox. Well, if it works on your skin, why not put it inside? I mean, but these are, really spurious, in my estimation, quite frankly, criminal stuff that people put online that confuse good people. And again, back to what Jessica just said, No matter what you're reading, find out what the source is. Where did it come from? Who did the research? What's the validity on this thing to you guys?
Absolutely. And to be quite honest and very transparent, this is a demonstration of science in progress. So the initial studies with hydroxychloroquine, with chloroquine, and ivermectin, to lump those three together, were in a laboratory setting in a culture plate with virus. And they basically flooded the culture plate with those drugs. And of course it worked. It killed everything, including the culture plate. But when you try and put that amount of drug into human body, it's just not compatible with life. And so the clinical studies, which deliberately tried to look for effect, and they were built for success, folks, failed to show any benefit whatsoever. And in fact, they did show harm. Beautiful case in point, same exact research approach with the Brazilian pit viper. Yes, an incredibly venomous snake whose venom was harvested, saturated into cells infected with SARS coronavirus 2, and it worked in laboratory setting. But do you see anybody running out to get themselves bit by a Brazilian pit viper? I don't think so, because you know it's dangerous. That's what the clinical studies showed. So that's why vaccines and antiviral medications that have been tested and shown successful do work. Not the other products, but it's not for lack of trying to find benefit. This is just science in progress.
Sean, I should correct myself on the hydrochloroquine is a malaria drug. The ivermectin was the antihelminth, and I only mentioned one drug, but you corrected it and put both drugs out there. So but in any case, both do not work against COVID, but one is for malaria, the other is to treat worms in animals.
Yep, you got it. You got it.
Ellen, thank you very much for calling from Prescott. And to those who are on the phone with us, you can still press 0 if we don't get to your call, because we're going to wrap things up here in a second. You'll be able to record a message, and then the folks are going to try to get back to you. I have just 2 final questions, but if I can ask the producers, we did want to ask one more poll question, and that is, did you find this town hall useful? We always like to ask that at the end, because the Department of Health is really trying to continue this outreach and to take questions on all of these various platforms in hopes of providing as much information and answering as many questions as possible. Did you find this town hall was useful and informative? You can press 1 if yes, and 2 if no. And I won't be offended, just go ahead and answer honestly, but we certainly hope that we were able to help you out today. So press 1 if yes, and 2 if you didn't find this very useful to you. Dr. Carmona, I wanted to ask you one question here, and then we'll have a quick closing. When we get vaccinations and booster shots formulated for variants, this is what they say. When will we get vaccinations and booster shots formulated for variants? Why don't we have them already 2 years into the pandemic? I'm tired of taking the same vaccine expecting different results.
Terrific question. I really appreciate you asked that. I mean, that's a very logical question. The good news is the vaccine is effective against the variants that are out there. Okay. What we worry about as we move to the future, could there be a variant that has a different characteristic? Because one of the things that's important to understand, viruses change all the time. One of the callers early on said they will mutate all the time. The real issue for us is which variant or which mutation causing a variant is clinically significant. And by that, I mean that it becomes more transmissible, it becomes more lethal, or develops resistance to our vaccine. Thus far, the vaccine is effective, and we have not had a need to develop a special one against any of the variants because our vaccines are working. We worry in the future that there could be a mutation that would cause us to have to try it, but we won't know that until there's a mutation. And if you want to prevent a mutation, get vaccinated and help yourself and help us stop the virus from spreading. And Dr. Elliott, that's his real area of expertise. So please jump in, Sean.
You hit it all. Thank you very much. I have nothing to add. So thank you. That's perfect.
And we're going to wrap things up here. I just want to ask one final question, and I'd like to ask it of each of you. Jessica, let me start with you. From your perspective, what does the future look like as we move into another phase of COVID? 6 months from now or a year from now, what can residents here in Arizona expect?
Yeah, thank you so much, everyone, for joining us tonight, and to my colleagues for being on this call, Dr. Elliott, Dr. Carmona, just fantastic as always, and it's such an honor to be here with you. As far as the future of COVID-19, you know, it's very difficult to say, but we do expect that we're going to head into this more endemic state where the virus is with us. similar to how we know influenza is here with us. What we don't know is what the seasonality of COVID-19 will look like, but we do know that it will be here. We need to continue to monitor and be vigilant by taking protective measures, getting everyone vaccinated who can be vaccinated, and monitoring the data. So if we're seeing strain on our healthcare system and increased cases, that we're taking responsible actions to implement our own mitigation steps, like wearing masks if there's an increase in cases, staying home when people are sick, that kind of thing.
Thank you so much. And thank you for being here tonight, Jessica. And Dr. Elliott, I'd like to ask you that same question. You know, with the patients that you see, I'm sure you're out there talking to folks all the time who are worried. You don't have a crystal ball, but what final words do you want to leave with the audience?
Thank you, Carrie. Thanks for hosting, and thanks also to my co-panelists. Thank you, especially for asking Jessica that question first, because it's a challenging, it's a great question. I absolutely agree. I think we are entering a period of endemic phase with the virus. I think we can anticipate gentle surges, although that's a loaded term. So gentle increases similar to the seasonality of the flu and RSV and common cold, as I talked about before. Yes, constant vigilance. Yes, continued vaccination. Absolutely vaccinating our youngers so that we can stop the transmission as quickly as possible at the school setting, but not letting our guard down. As tired as we are, this is the ninth inning, and I'm a Cubs fan, and this is where we make it or lose it. I don't want to lose it like I do with the Cubs, so we got to keep vigilance going on. Thank you.
Thank you, Dr. Elliott. And Dr. Carmona, I'll leave you with the final word, sir.
Well, first and foremost, I'm very thankful for you, Carrie, coming here and coordinating this for us, and also to my colleagues, Jessica and Sean, who are truly experts in the field and work tirelessly to try and keep our community, our state healthy. I echo what they say, and I think our parting words are encouraging everybody to get vaccinated, because it not only protects you, it helps us to protect the community, helps to drive this to an endemic stage where the virus will be in the environment, but it has no place to go, because either people have been infected or they are vaccinated and they've accelerated herd immunity. This is the story of, as somebody said earlier, it's evolution. Darwin tells us how this will end. It will continue to move forward until it has no place else to go. And then it will be a lot like polio. Once in a while, you'll hear about a case, but really it's very unusual now to have cases in any developed world because all of our children are vaccinated. Vaccination, again, probably the most important scientific advancement in modern history.
Thank you so much, Dr. Carmona, and thanks to all of you who are watching and listening. I can see a lot of you weighing in on the poll question and saying that this was, in fact, helpful. This town hall was helpful, so I'm so glad to hear that. You can stay on the line if you wanted to ask a question and we weren't able to get to that question. I'm told that you can stay on the line and you'll be able to record a question, and they are very determined to make sure everyone's questions are answered. You can also write an email to aztownhalls at aztownhalls@azdhs.gov. Sorry, a lot of information here to distribute tonight. I'm Carrie Pena. Thank you so much for being with us here streaming online and on the phone. We appreciate it. Stay safe and stay healthy. Good night, everyone.